If you've got foot or ankle pain from running and it just won't go away, chances are you're making at least one of these 5 mistakes that I see all the time. But don't worry, we've got all been there. In today's video, I'll show you what not to do so you can finally start running pain-free again. These are the exact mistakes I see runners over 35 and all ages make all the time, whether you're dealing with plantar fasciitis, posterior tibial tendon pain, ankle instability, or just that nagging foot tightness. Let's break down these mistakes. Hey there, I'm Dr. Abby Siler, a physical therapist and running coach that helps runners over the age of 35 run pain-free for life. All right, mistake number 1, only resting, not rebuilding. It's easy to think that rest alone will fix the problem, especially when you're in pain. And yes, in the first few days of acute pain, a little rest is okay. But after that, you're missing the boat if you're not progressively rebuilding your ankle and your foot. Most foot and ankle injuries come from tissues that are overloaded because they've been underprepared. Rest just doesn't fix that. Rest doesn't fix being underprepared. Strength training helps prepare your tissues. So what do you do instead is you start with gentle loading of the calf and tendons early. You want to do calf raises, towel scrunches, banded footwork. You want to build load tolerance in the plantar fascia, the Achilles, and the posterior tib by adding single leg stability work to address control as well. Mistake number 2, focusing only on the foot. If you're only looking at the foot, you're only seeing part of the problem. Every step you take starts at the hip. Your hip is your base of support in your core. If your glutes aren't strong enough and firing the right ways, then your body is going to compensate by dumping more force into the lower leg and foot and making them compensate for what your glute strength doesn't have, your hip strength doesn't have. That means poor core and hip control can literally cause your feet to overwork and break them down. So again, what do you do instead? 1, strengthen your glutes, especially the glute medius. You're going to add core control exercises like dead bugs, planks, bird dogs. And then also use a video or a mirror to help check for hip drop or knee collapsing in during your running. Setting it up on a treadmill is a really easy way to do it. I also offer gait analysis if you want to submit something to me and work on that with me. Mistake number 3, stretching your calves too much. Stretching is great. It feels good. It's useful, but it's only temporary. And overdoing it can actually backfire a lot of times when you feeling all this tightness. Tight calves are usually a result of poor ankle mobility, stability, and muscle fatigue. Stretching won't fix those if the muscles are weak or over-reliant on using that tightness in the calf muscle to provide the stability. Especially with things like posterior tib pain or Achilles tendinopathy, aggressive calf stretching can actually worsen your symptoms and prolong your injury. What you do instead is use eccentric calf strengthening exercises. You want to work on ankle dorsiflexion mobility, which dorsiflexion is pulling your toes back towards you, and you can do this with some banded joint mobilizations and some other things. And then also include soleus focused work. Soleus is that deep muscle in your calf, so doing things like bent knee calf raises. Mistake number 4 is skipping foot strength and balance work. Shoes, insoles, and orthotics can really support your foot, but they won't strengthen it. They make you reliant on that, and your foot is made up of so many muscles and joints that need to be trained that they are super resilient, and they can really make a difference and support themselves without those insoles and inserts. Just like your glutes or your core, they're very supportive and stabilized focus. If your foot lacks stability, you'll always be relying on that external support though, and that can get expensive. That limits your ability also to absorb force and increases your risk for re-injury if you don't have that control and stability in your foot and you're relying on outside forces. What to do instead is work on toe yoga, short foot exercises, and arch lifts. Practice single leg balance, either barefoot, and then to make it harder, you can turn your head or be on an unstable surface like a pillow or something. And then also incorporate foot intrinsic work to help into your warm up or cool down to really get those muscles working and woke up. And finally, mistake number 5, rushing back to running too soon if you've taken time off. This one stings, and I get it. But the most common pattern I see is runners, they are feeling just good enough to start back running. So they go back to running, and let's face it, runners don't do anything by a small amount. We go head in. And then you start back running, and then your injury and pain flares up that first run or a couple runs in. Your tissues might not hurt anymore, but that doesn't mean that they're ready to handle the full impact of running yet. Healing is a process, a slow process sometimes, and it's not just a switch you can flip. What you do instead is follow a walk-run progression with built-in rest days, monitor your pain, not just during, but after for a couple of hours, and then the day after as well, and see how you're doing. Ideally, you should have symptoms resolved by 24 hours. And then also layer in some return to running drills, such as skips, marches, hops, and things like that before your runs to really get your body primed and tuned into what you're going to ask it to do. So if you've made any of these mistakes, such as resting too long, skipping strength, relying on stretching, don't worry, you're not alone. You can really recover from this with the right help. You can download my full 12-week foot and ankle rehab program that's linked in the description if you're ready for a clear step-by-step plan. And then if you want personalized support, or if instead you want personalized support, you can apply for one-on-one coaching with me and really get you back to running pain-free. If this helped, hit the like and subscribe so more runners can avoid the injury loop. Make sure you share it with your friends, your runner friends that really need that help and that motivation to get to running pain-free. Drop a comment below and tell me which mistake you've made before, because we've all got one. See you in the next video.